Young children are starting to make up the bulk of Singapore's active COVID-19 cases in hospital amid an Omicron wave. The country's pandemic taskforce is preparing more beds for them and is urging more young people to get jabs. Sherlyn Sia reports.
More young children are getting COVID-19. In just a little over a week, cases of kids aged below 12 have doubled to over 300. While doctors could send most to recover from home, more than 40 ended up in hospitals or treatment facilities. There have also been instances of more serious complications, including a multi-system inflammatory response where body organs get inflamed due to COVID-19. About 15 children have developed it here so far, an incidence of 0.1%, and that's higher than earlier reports from other countries. The COVID task force is now warning that Omicron could land even more kids in hospital.
Although Omicron is said to affect the upper airways more than the lower airways in infected people, with a lower rate of pneumonia setting in, children are very sensitive to inflammation in the upper airways, and this can cause wheezing and breathlessness. So more children with Omicron infections are being admitted for treatment, but thankfully, they do not require long hospital stays or ICU care. Nonetheless, the increase in admissions fills up the beds in our pediatric wards that are dedicated for COVID-19 infected children. And we're working closely with both hospitals to ensure there's sufficient bed capacity for the children.
To preserve these resources, health protocols have been tweaked. More children aged 5 to 11 with mild or no symptoms can recover at home for at least 3 days. Non-serious cases should go to a GP instead of going to hospital. The task force is urging children to get their COVID-19 shots. It assures parents that the pediatric dose is safe and effective. Vaccination for children aged 5 to 11 started last month. So far, 13,000 doses have been given, with no serious side effects.
6 non-serious adverse events were reported, including minor allergic reactions like hives, some reports of dizziness, fever, and shortness of breath, which resolved spontaneously. In particular, there were no reports of myocarditis or pericarditis received since the commencement of our vaccination program for these children.
Boosters are also now extended to those aged 12 to 17 starting next month. There are no plans to give these to younger children yet, but the task force says it will study that possibility if needed.
Singapore's pandemic task force is also gearing up to protect healthcare resources. New measures include having more designated hospital beds for COVID-19 patients and changes to visiting policies. The Omicron wave is expected to last until February, with daily cases possibly going over 15,000. Clara Lee with more.
Singapore hospitals are standing by to convert more beds for COVID-19 patients if needed. This will go beyond the nearly 1,200 beds currently reserved for them. The Health Ministry's Director of Medical Services, Kenneth Mark, says this is to ramp up hospital capacities as cases rise.
When we see a very high total number of cases in the community, even a small percentage of more severe infections may mean a high absolute number of cases, which require admission into the hospital for care. And this can easily overwhelm the existing bed capacity that we have within our hospitals.
Healthcare protocols are also updated to allow more people to recover in community treatment facilities. Children aged 5 to 11 years may now be cared for in CTFs, regardless of their vaccination status. To protect more vulnerable seniors, in-person visits to elderly care homes and hospital wards will also be suspended for the next 4 weeks. The task force says these restrictions will be reviewed when the community situation improves.
Patients and residents in the homes may continue to connect with their loved ones using alternative means for communication, including through the use of the telephone and video calls. And as before, healthcare institutions will be allowed to exercise some discretion and adjust these restrictions for exceptional cases on a compassionate basis.
Travellers under the vaccinated travel lane schemes can now take their antigen rapid tests unsupervised from the second day onwards. Findings show the Omicron variant has a shorter infectious period. Therefore, fully vaccinated travellers only need to isolate for a week, down from 10 days. Other safe management measures will remain in place leading up to the Chinese New Year.
I know that many of us are hoping for a relaxation in SMMs as we approach the Chinese New Year. However, it is important that we continue with our existing SMMs to help prevent overloading our healthcare system, even as we experience a surge in cases from Omicron, the variant.
He adds that the task force will take a step-by-step approach to resume more economic and social activities.
Meanwhile, businesses have been urged to put in place robust continuity plans to mitigate the effect of infections on their operations as Singapore rides the Omicron wave. The task force says the Omicron variant accounts for about 70% of daily cases, and these cases are expected to rise.
We must be prepared that a significant proportion of our workforce may be infected with COVID-19. If we have, for example, 15,000 cases a day, which is very possible, with each one of them out of action for an average of, say, about 5 days, we are looking at some 75,000 workers absent due to COVID-19. If we include those who are close contacts and have to isolate themselves, the number will be much higher, and they may be concentrated in certain companies or specific sectors. Services may therefore be disrupted from time to time.
COVID-19 hospitalization numbers will get more attention than the daily infection tally as Singapore records more Omicron cases that are less severe. Health Minister Omicron says that if hospitals are stable, the country can ride through the Omicron wave with current safe management measures.
With vaccinations working well and the Omicron variant being less severe, the top-line infection number is becoming less and less meaningful in our response to COVID-19. It comprises mostly people who are vaccinated, who are experiencing mild symptoms or no symptoms, which from a public health point of view is not something we should be overly concerned about. The more important statistics are in the bottom line. How many people are severely ill, needing oxygen supplementation? How many is in ICU care? How many died?
Authorities are also expanding the type of cases added to the count, and this will increase the number of new infections. It will include those prescribed self-testing and home recovery by general practitioners. These are more prevalent as the proportion of less severe cases increases. Delta and Omicron cases will not be differentiated.